Welcome back. I'm your healthcare advocate, Cary Hall. You're listening to America's Healthcare Advocate Show, broadcasting here on the HIA Radio Network. My producer, Mr. Rob Babcock. My special guest in studio, Ron Rowe, Senior Director, Consumer and Small Group Markets, Blue Cross and Blue Shield of Kansas City. If you want information on these products, you want to know more about this, you can go to your local broker and ask him, or call 816-395-2939. 816-395-2939, or go to their website, bluekcexchange.com, bluekcexchange.com. This is a special broadcast for the Kansas City Metro, folks up in the Sedalia area, and all you folks up in northern Missouri, up around St. Joe and further out, Trenton, Missouri, etc. So we're talking basically to everybody in the 32-county area that Blue Cross and Blue Shield of Kansas City services. Ron, before we went out, we talked a little bit about this. We're going to get into this now, and as I say, kind of get in the weeds. Defined benefit versus defined contribution. When people think about that, probably the easiest way to look at a parallel to that would be to look at 401k versus defined benefit pension funds, yes?
Absolutely.
Right, why don't you take us down that road?
Great example. Okay. Defined benefit in the pension plans moved away from, the most of them did, from a defined benefit to a defined contribution in the 80s. For some of the same reasons that we're thinking that this is a good option for health insurance. Employers could not afford to fund those defined benefits anymore, okay? Here's a perfect example. The old defined benefit pension plans. You come to work, you work for 20 years. At the end of 20 years, your employer is going to give you $2,000 a month for the rest of your life. At the end of 25, you get $2,500. At the end, if you stay for 30, you'll get $3,000 a month for the rest of your life. That was a defined benefit, and the employer had to fund to that benefit. They had to take their investments and so on and so forth, and make sure that they had those monies available, that benefit available to those employees when they retired. Well, that got to be more expensive, and as time,
unsustainable.
And as time went on, the benefits had to go a little bit higher because of cost of living, and the employer said, I can't afford this anymore. So they said, we're going to shift to a defined contribution. I'm going to give you so much per month as the employer, and you can take that money and invest it however you like towards your retirement. That's what a 401k is. A 401k is a defined contribution. Now, it's tied to how much your salary or how much you contribute or something, but at the end of the day, the employer has said, this is how much I'm going to pay versus these are the benefits I got to have in place, and I got to figure out a way to have those benefits in place. The Blue KC Exchange gives the employers the exact same option for health insurance. Rather than coming in and saying, I need a $1,500 deductible for my employees, or I have to have an HMO or a $2,500 deductible, or what benefit can I afford? This is the benefit I'm going to offer, the benefit I can afford. The employer says, I'm giving each one of my employees X amount of dollars. For an example, $300. Everyone who works for me is getting $300 a month for their health insurance. They go out to the Blue KC Exchange. There's 10 products out there, and you can buy whichever product you want with the $300 I give you. If a product on the exchange costs $400, then we're going to take $100 out of your check to cover the difference. If a product out on the exchange costs $300, then nothing will be coming out of your check. So the employer is controlling the amount of money that they're giving the employees by setting a defined contribution, and the employees are able to go out and buy what it is that they want and need. Okay, under the defined benefit, when the employer says, all I can afford is $2,500 deductible, so everyone's getting a $2,500 deductible, well, you have people in that company that say, I don't want a $2,500 deductible because I don't need that much. I would prefer to have a $5,000 deductible. Or you also have people in there that maybe say, well, I have sick kids and I really would like to have a $500 deductible plan, but that's not an option for them. On the Blue KC Exchange, it is, as long as they're willing to pay the difference out of their pocket. So,
yeah, so what you did is you took, from an employer standpoint, one of the most difficult things they have to do is, you go into the employee meeting, and
right.
you're waiting to see if they're going to throw food. You know what I mean?
Exactly.
I've been in many of these meetings, Ron. Now we're going to tell you what you're going to get, and that immediately they're apprehensive. The deductible went up, the benefits went down, the whole 9 yards.
Right.
You change that whole equation because you're saying now, here's $300. You want an HSA plan? Hey, you know what? It's going to cost $200. You've got $100 a month left over. You can put in your HSA account,
you can buy vision, dental. And you can't take it in the form of cash, but you can buy other benefits with it. You can't
go down the street and buy Cerveza with it.
You can't.
No. But you can use it for other benefits. Now back to the 30-year-old with 3 kids who needs first dollar coverage for everything because they're in and out of the emergency room. The kids got this, that, and something else. He can take that $300 and go, you know what? I'm going to pay an extra $50, and I'm going to go to $350, and I'm going to buy Blue Premium.
Right.
That's what I want. Right. That's going to cost me $350, so I'll pay $50 a month more for that. So now he's happy because he got what he needs. Then you've got the 21-year-old in the middle who's invincible. Faster than a speeding bullet, more powerful than a locomotive, and they can leap tall buildings at a single bound.
And they don't want or need anything.
Thank you. They certainly don't need health insurance, but they can go get an Affordable plan with a limited number of benefits in terms of limited number of doctor visits, whatever the case may be, first dollar coverage for their wellness benefits, which if they're guys, they never use anyway. But it's there, all right? And then they can take that additional money, and maybe they can go get a dental, a vision, whatever, a cancer, critical illness, whatever the case may be, other products that are being offered and enhance their benefit that way. So you've got three different scenarios, but you got a plan that fits everybody.
Exactly.
Back to your first scenario, you had one plan, size 44 overcoat. Everybody's got to wear it. I don't care if it fits or it doesn't fit.
Well, and you think about the analogy we use with the pension plans. Exact same thing happens with the pension plans. If you're taking your money, you're a young employee, you just started work at the company, and you're taking your money and you're putting it in a 401k mutual fund, probably very differently than the 64-year-old that's just getting ready to retire. They don't need any risk. So just think about, it's the same thing on the health insurance side. The individual gets to do with that money that the employer's giving them with what they need, what they want, and what they need. And the employer says, I know exactly what I'm going to pay. I know exactly what I'm going to pay. I know how many employees I have. My costs are a fixed cost now. And you know what? As those rate increases come and keep coming, because they're going to keep coming, the medical inflation is not going to go away anytime soon. If you look out and listen to the actuaries, the employer then at that point, the employees can decide, do they want to have more come out of their check and have a lesser benefit or richer benefit, and the employee, it's a much easier way for the employee to say, here's they're taking a benefit now and really making it a benefit versus going into the enrollment meeting, like you said, and have to tell them that I'm taking away something from you by giving you a higher deductible. Something
I see as a side benefit to this that's going to happen, I think you're going to see participation rates go up in companies where before people just said, I'm not going to go onto the health insurance plan. I'll go buy one by myself, or I just won't have health insurance. I think you're going to see more people participate. One of the biggest things we get in companies, a lot of times we go in, we can't get a lot of these people to participate, or they don't want to put their spouse and children on. They're only going to put themselves on because the employer is footing the bill for the majority of the premium. I think that's going to change with this, right?
I think it could. That's one thing we're hoping will happen. We'll time will tell, but we'll watch and see.
I definitely think it is going to happen. If you want information on this, ladies and gentlemen, 816-395-2939. That is the phone number. Call your local broker. Ask your broker. Brokers distribute this plan all over the 32 counties I talked about, or online at bluekcexchange.com, bluekcexchange.com. When we come back from the break, we're going to talk about the mechanics of the exchange. How does it work? What can you do with it? We're going to go into more detail on that. Once again, this is an opportunity, especially for small business people, to learn how to manage your health care and health insurance costs. We'll be back after the break. You're listening to America's Healthcare Advocate, broadcasting on the HIA Radio Network, coast to coast across the USA.